Hi, I'm Dr. Chun and Khaw. For this AJODO video of the month, I'll be presenting the research I undertook as part of my specialist training in orthodontics at the University of Sydney in Australia.
We conducted a randomized controlled trial investigating the effects of low-level laser therapy on the repair of orthodontically induced root resorption. So, what was the rationale behind this study? It has been reported that up to 91% of teeth can experience some form of root length loss during orthodontic treatment, whilst severe resorption of more than 3 mm has been reported in 10 to 20% of cases. Based on research undertaken at the University of Sydney, management of severe root resorption may involve a 2 to 3 month treatment pause. Resorption is reduced following removal of hyalinized tissue, whilst cemental repair has been observed to occur up to 8 weeks post-forced cessation. A modality that is regaining popularity in research is low-level laser therapy. This has been reported to promote soft and hard tissue healing. The effects of low-level laser on cemental repair and remodeling have been investigated in a few studies, but with mixed results. We were interested to explore whether this modality could influence or enhance cemental repair. Thus, the aim of this study was to investigate the effect of low-level laser therapy on cemental repair during a simulated treatment pause in a human model after a 4-week period of 150 grams of buccal tipping force. Study design. This was a 2-arm parallel split mouth trial with equal left and right side randomization as low-level laser treated or sham control. A total of 20 patients requiring bilateral maxillary first premolar extractions as part of their orthodontic treatment plan were recruited in this study. Experimental setup. Self-ligating 0.022 brackets and tubes were bonded on first premolars and first molars respectively. 150 grams of buccal tipping force was applied to the first premolars via a 1725 beaded titanium cantilever. After 4 weeks of force application, the brackets were removed and fixed retention constructed from 18 thou stainless steel wire. This was cemented to the buccal surfaces of upper bicuspids and first molars. This retention phase lasted 6 weeks, with the experimental side receiving a laser application of 4 points buccally and 4 points palatally. This occurred weekly for the entire retention phase. Positive control sides received a sham application with identical settings on the laser unit, except with output blocked via a sham function. At the end of the retention phase, the first premolars were extracted, scanned with micro CT, and had their resorption crater volumes measured. Blinding of patient and operator was performed at all stages during laser application and crater volume measurement. Results. What did we find? All patients completed the study and total crater volumes for the laser-treated teeth and sham were similar. When surface regions or root thirds were investigated, no significant difference was found between laser and sham groups. No harms were observed. Limitations. One of the limitations of this study was that the available data collected was only through micro-CT. Data obtained from the use of histology may provide qualitative analysis of craters with a further insight into the cellular and molecular response to low-level laser therapy. On the other hand, the drawback with histology is the possible distortion of information through various planes of section. Possible development of software-driven 3D reconstruction may provide a whole-tooth histological dataset, allowing for both a qualitative and quantitative analysis of root resorption and repair. Lastly, many factors may affect energy delivery to target tissues, and future research may influence the refinement of laser parameters to help overcome this. The authors would like to thank the Australian Society of Orthodontists Foundation for Research and Education for their kind financial support, and Khaw Photomedicine in the UK for providing the training on the laser unit.